Hey folks, I'm Anna and this is my lovely volunteer Isabel. She's agreed to be my volunteer during my palpation videos of the anterior and posterior hip. So let's get started. I'm going to have you lie down on your belly, this underneath your belly. Alright, so I'm going to start off by pointing out two muscles that allow for lateral rotation of the hip. So the first muscle is going to be the piriformis muscle. That muscle originates on the anterior surface of the sacrum, so I'm going to be palpating here on the posterior part of your sacrum. So again, the origin of piriformis is the anterior surface of the sacrum, and it inserts onto the greater trochanter of the femur, so we can rotate this back and forth in order to find the greater trochanter. So piriformis muscle is right here, and we can move kind of transverse to it back and forth in order to run across its fibers. And if I could have Isabel push against my hand, please. There we go. We can have fine contraction of the piriformis muscle. And for the second muscle, the quadratus femoris muscle, I'm going to first point out the ischial tuberosity. Now the ischial tuberosity is part of the bone that we sit on throughout the day. This area is also a frequent site of pressure sores on individuals that are wheelchair bound. So we'll take that into consideration. And Isabel, at any point of this, please let me know if you feel uncomfortable, but I'll try to use firm pressure and use large parts of my hand to palpate. I'm going to palpate the bottom of your ischial tuberosity. So I'm going to run up with the back of my hand here to the ischial tuberosity. So that's the origin. The lateral part of that bone is the origin of the quadratus femoris. So I'm going to go up again. So ischial tuberosity, and then it inserts onto the greater, or excuse me, the intertrochanteric crest of the femur. So between the greater and lesser trochanter. So go ahead and press against my hand again, please. There we go. A very deep lying muscle. Go ahead and relax. Quadratus femoris is a very deep lying muscle. It is deep to the sciatic nerve that runs through here. Whereas with the piriformis muscle, the sciatic nerve runs deep to that muscle. So that means that if we have any overactivity of the piriformis muscle, that we might have certain sciatic nerve impingements that can cause like a tingling or loss of sensation down the back of her leg. So Isabel, at this point, I'm going to have you flip over, please. I'm going to remove that. Yeah, thank you. Alright. So now we're going to locate some structures on our anterior pelvis. For this part, we don't have to, we can close this off. We'll do some stuff first. What I want to point out is the anterior superior iliac spine, so abbreviated ASIS. So I'm going to first find these iliac crests, okay, and then kind of using the broad surface of our hand to avoid any kind of tickle response, right? We're going to find these anterior superior iliac spines, having first located the iliac crest. Having found that ASIS, anterior superior iliac spine, we're going to run kind of the palm of our hand across the inguinal ligament. That inguinal ligament runs from the anterior superior iliac spine to the pubic ramus. Also in this kind of bikini line area, we can find the femoral nerve, artery, and vein. So I'm going to go ahead and find the inguinal pulse according to that femoral artery right in here. There it is, nice and strong, good. But we have to be careful when we press down in this region that we don't pinch on too far. We don't want to pinch on the femoral nerve, because that could also cause like a tingling or numbness sensation lower down our leg. Next I want to point out is the tensor fasciolata muscle, kind of in this lateral anterior region of her hip. So as a marker, we can find the anterior superior iliac spines again. So here with the palm of our hand, and going up there about 2 inches toward her iliac crest. So this area right here is our tensor fasciolata. And that allows for kind of twist your leg this way inward. Very good. So that muscle allows for medial rotation, just as she did right there. And push up against my hand, please. There we go, and relax. So flexion of that muscle, of the femur at the hip, and go ahead and press against my hand. There we go, and relax. An abduction of the femur at the hip. That's all the actions of the tensor fasciae lata. That muscle goes down to about the level of the greater trochanter, at which point it blends into the iliotibial tract and inserts onto the tibial tuberosity down here. And next, in addition to that one hip flexor, I want to point out two other hip flexors. So for this, can I pull up your shirt just so I can expose the navel? Alright. So next we have is psoas major. That hip flexor, we can find it originates in the lumbar spine on the bodies and transverse processes of the lumbar spine. So I'm going to kind of find the halfway point between the ASIS and the umbilicus. Kind of go up halfway in here, and then we're going to be really gentle. Now this one might hurt a little bit, so please let me know if you ever want me to stop, but I'll try to use broad but firm pressure of my finger pads. So I'll do this slowly. Alright? It's just a little bit uncomfortable sometimes. I'm going to go ahead, please lift this leg, please. There we go. There you go. So that's psoas major. Next, I would like to find the iliacus muscle. So this one, it might be a little bit ticklish. So I'm going to go ahead, will you give me your hand, please? I'm going to lay it over top mine, so it'll help inhibit any kind of tickle response. We don't want any tickle response, so go ahead and what I'm going to do is, I'm right here on the iliac crest. And so I'm going to sink my fingers down, kind of hook them into the interior aspect of that, or along the iliac fossa, in order to find the iliacus muscle. So here, using firm pressure. And go ahead and lift this leg again, please. Very good, and relax. So that's the iliacus muscle. And that's pretty much all my palpations.